When the public is listening to this, I wish that they can know that if they're suffering from nasal symptoms or sinus symptoms, that there is professional help that they can get. By seeing us in the office, we can do a very thorough evaluation, examine, their ears, their nose, their throat, look in the sinuses, and then we can provide them either with medical treatment that's necessary, or if medical treatment fails, we can provide them with surgical treatment. I think the mistake that some people will sometimes do is, they'll just suffer with symptoms and not consider, professional help. Hi, my name is Faraz Sabeh. I'm a sinus and skull-base surgeon at UF Health Jacksonville. I'm an ENT surgeon who's subspecialized in rhinology, so I deal with disease processes of the sinuses, the nasal cavity, and I do skull-base procedures with the neurosurgeons. I help patients who deal with chronic conditions such as chronic sinusitis, recurrent nosebleeds, nasal polyps, difficulty breathing through the nose. And then from a skull-base surgery perspective, we deal with situations such as, CSF leaks, pituitary adenomas, or different types of skull-base pathologies that require a combined approach between a skull-based neurosurgeon and a skull-based ENT. I think the advantage of coming to UF Health Jacksonville is we have a very experienced team, and a team that's assembled of different specialists. So like if somebody's coming to see me, I've not only spent time, training as an ENT surgeon, but then I spent extra time honing in on learning my sinus and skull-based surgery skills. So I spent a whole year at Harvard Medical School operating and, doing clinics and kind of, mastering that skill. And then the same can be said about some of my other partners. They are subspecialized in their area of expertise. So you're not just seeing an ENT physician who does a little bit of everything. You're seeing a specialist who's more focused on the disease process. And then that really helps for a more collaborative structure. So if I get a patient who's seeing me for nasal issues, but then, during the visit, they mention an ear complaint or a voice complaint, and it's something that's sort of, more specialized, it needs special attention, I can send it to my partners who are more specialized in the ears and more specialized in the throat.